SANAC says it's important to incorporate HIV and TB into the country's COVID-19 response. For more, we're now joined by SANAC Acting CEO Coceka Nogoduka. Coceka, a very good morning and thank you so much for joining us. Who or which NPOs will receive the additional funding?
Thank you very much for inviting us. The Global Fund is not coming to South Africa for the first time. They have been supporting the implementation of the National Strategic Plan on HIV and TB. There's 4 principal recipients that are already receiving Global Fund grant. So this additional grant will also be channeled through that system to ensure that we do not delay in the implementation. So these principal recipients are the National Department of Health, Beyond Zero in the Eastern Cape, Coceka in the Western Cape, and we've got AIDS Foundation for South Africa based in KZN. These NGOs, as indicated, are principal recipients, so they work with local NGOs and CBOs, local organizations for the implementation at a local level. So we will be working with the existing, what we call sub-recipients, and we'll also be calling for new proposals for new sub-recipients to ensure that we strengthen the implementation of HIV and TB during the COVID-19 pandemic response in South Africa.
Does this form part of the 500 billion relief fund introduced by the presidency, or is this separate?
This is separate. It's additional resources that we are receiving as a country. It's about $36 million US, which translates to about 600 million. The bulk of the budget of that money will go directly to supporting the Department of Health response on COVID-19, but more strengthening the community-based services, community screening, community testing, ensuring that our local health facilities are ready to confront and respond to COVID-19. And you would understand that as a country, we've been complaining about information management system. From the President's Fund, we have developed an information management system, but we need to take that to facilities, to local hospitals. So this Global Fund grant is going to really assist us in strengthening that at local level response. COVID-19 is fully integrated and fully responded to, but also impacted HIV and TB.
So, Coceka, how will you be able to separate when the funding goes towards COVID-19 efforts and when it goes to HIV efforts and when it goes to TB programs?
You would remember that, as I've indicated, based on the National Strategic Plan, we have been implementing HIV and TB, and we've had resources. Global Fund is one of the contributors. So we've got resources that are specifically for HIV and TB. So this additional resource is to ensure that we redesign our programs, because with COVID-19, we've learned some new lessons, though it has set us back in terms of the response, but we've learned new approaches in terms of how do we respond to epidemics. So this funding is going to strengthen in that source. But also we've learned that, we've known that communities are critical in responding to epidemics. Local response needs to be strengthened to respond to epidemics. So this pot of funding, it's a 1-year grant. It's got specific activities and specific timelines and specific targets. So it will be then traced and tracked to ensure that we really deliver on ensuring that the COVID-19 response is strengthened at local level, but also HIV and TB is integrated into that response.
I take you again back to that President's 500 billion announcement of a coronavirus relief fund. You're saying it's 600 million that is supposed to be stretched over 12 months. Concerns arise about the funds ending up where they are meant to and the prospect of corruption. What security measures have you got in place to counter this?
You would remember that donor funding always comes with restrictions. Donor funding always comes with standard operating procedures for procurement. So this funding also comes with that restrictions and oversight frameworks that we need to adhere to. Global Fund has resources in the country that tracks and manages the implementation of the grants that they give to South Africa. So working with the local funding agency, working with the Global Fund country coordinating mechanism, mechanism, which is a structure that oversees the implementation of Global Fund in South Africa, and aligning with the systems that we have in the country that regulates NGOs in terms of how they procure and how they account for resources. We will ensure that we have a clear oversight in the implementation, and you would understand that the majority of the funds goes also to protective equipment, the PPE, and we are aware of the challenges that the country has faced with the current procurement of PPE. So working closely with the relevant bodies, we will ensure that we monitor the procurement, we monitor the expenditure, and we also be able to account to the country plus also to the Global Fund. So the four principal recipients that are receiving this fund are always aware of how funds need to be spent and what are the oversight mechanisms for those funds.
It's a generous donation. When you pit it against the financial requirement needs of SANAC at the moment, how far will it go towards ensuring that you fulfill your mandates?
This is quite a generous contribution. We welcome it as SANAC. And looking at the resources that we already have, it's not that small of an amount. I mean, we've spoken to the President Fund. We've spoken to the reprogramming of existing budgets within Treasury. We've looked at how we've reprogrammed other donors, your donors like US government, PEPFAR. So this donation is going to go a long way, especially at a local response. I think at the beginning of the epidemic, we were focusing at a national level, we were focusing at a provincial level, we were focusing on ensuring that we've got enough beds to respond to COVID-19. But with this fund, we want to ensure that we strengthen the existing systems, we strengthen our primary healthcare systems, we strengthen our community-based systems to ensure that at a local level there's a strengthened response. So this amount of money is welcome. It's going to go a long way, and it does contribute to the financial needs of the country as well as of SANAC in terms of responding to the NSP. As you are aware, the COVID-19 finds us in the implementation of the National Strategic Plan not meeting our targets. We've got more than 5 million people currently on treatment, with 7 million people currently living with HIV in the country. So you can already see that there's a gap. We have new infections of 220,000 per annum, which we need to reduce. So this contribution comes at a stage where we were not meeting the NSP targets. COVID-19 came, the lockdown regulations and restrictions really diverted the HIV and TB response in the country. So we are hoping with this additional funding, we are going to be able to refocus our efforts and make sure that we are able to respond to HIV and TB during COVID-19 response in the country.
You know, our viewers constantly complain that we make all of these grand announcements and yet there is no way of tracking how these, like this announcement about the funding, how it impacts communities, the effects on the ground. What would happen that would indicate that this has been a successful program?
For us, for this to be a successful program is really to redesign access to HIV and TB services and COVID-19 for our communities. We want to ensure that at a community level, we are starting to see mobile facilities coming to communities. We want to make sure that we are seeing community-based services where we've got pop-up sites where we'll be screening for COVID, we'll be testing for HIV, and we'll be screening for TB. We want to make sure that we've got door-to-door campaigns where we will be bringing masks for our communities, where we will be bringing a health promotion advice, where we will be distributing HIV self-test kits, where we will be going also having a program that will be going home-to-home support for our patients that are COVID-19 positive but are isolating at home. We want to make sure that at a community level those services are there and available. We want to make sure that our communities are able to access HIV and TB treatments without necessarily going to a health facility. So this grant is really going to strengthen those approaches to make sure that we are talking about communities benefiting from the response, and we want to make sure that our NGOs and CBOs that are going to be accessing this grant will really be ensuring that at a community level there is a response and communities are able to access services differently from how they were accessing services, because as we are aware, there are challenges currently with COVID-19 regulations and restrictions in movement, but also our healthcare workers are getting infected with COVID-19, therefore resulting in health facilities closing, and communities are unable to access health services when facilities are closed. So with this grant, we really want to strengthen our community-based services so that at a community level, at a ward level, communities are able to access services.
So yesterday, during his Women's Day address, President Cyril Ramaphosa committed 40% of procurement spend that would be reserved for women. In terms of your procurement decisions, are you thinking in this way at all? Or how are you making your procurement decisions?
We are thinking about the decision that the president has taken. So as the following week, because this news of this grant only came to us on Friday, so we will be this week, coming week, sitting down and really looking at how do we strategize to align our procurement with where the country is going. How do we align the procurement to make sure that women and SMMEs do benefit for community-based interventions that we are going to be delivering. As you are aware, currently HIV and COVID has followed the same trend. Women are mostly affected and infected by both COVID-19 and HIV. So our response needs to ensure that we do empower women with the financial resources that we have. So as we look at how do we ensure that we disburse these funds, we will incorporate the President's guidance on our procurement frameworks as we go forward.
Thank you so much for talking to us, Ms. Coceka Nogoduka from SANAC. Thank you so much for the time.
Thank you.